Getting kids outside and moving instead of sitting and logging more screen time. Some youth sports organizations and parents say let the kids play, but others have health and safety concerns, especially when it comes to high-contact sports. So what needs to be done to get athletics going again for our keiki? We'll hear from coaches as well as the head of the state's High School Athletic Association on COVID-19 youth sports. Tonight's live broadcast and live stream of Insights on PBS Hawaiʻi start now.
Aloha and welcome to Insights on PBS Hawaiʻi. I'm Laura Yamada. Well, it's a complex issue happening all across the country. How to get kids playing sports again without contracting or spreading COVID-19. The entire fall and winter seasons were already canceled for high school sports like football, basketball, wrestling, swimming, and volleyball. And here on Oahu, where positive case counts have been the highest, other organized outdoor team sports are also currently not allowed. Our panel tonight will discuss what it will take to give the green light on youth sports. So we look forward to your participation in tonight's show. You can email, call, or tweet your questions, and you'll find a live stream of this program at pbshawaii.org and the PBS Hawaiʻi Facebook page. All right, now to our guests. Chris Chun is the Executive Director of the Hawaii High School Athletic Association. The nonprofit oversees high school sports across the entire state for both public and private schools. Mitchell Otani is an executive council member with the Oahu Interscholastic Association, or OIA. He is in his 11th year, as well as the principal at Kalani High School in East Honolulu. Cora Fonseca is the owner of the Rainbow Gymnastics Academy in Aiea, the family-owned and operated business opened back in 1985. Christopher Keem is the president and CEO of the Oahu League of Hawaii Youth Soccer. The league is comprised of more than 24 clubs with players ranging in age from 6 to 19. And Lieutenant Terrence Gomez has been with the Maui Police Department for 22 years. He's the director of the Maui Police Activities League, a nonprofit that offers kids' sports programs free of charge as a way to deter delinquency. So thank you so much, all of you, for joining us. We know this is so important to so many families, this discussion, so all of your voices are really important. So maybe, Lieutenant Gomez, let's start with you. Let's talk about, I believe it's called MPEL, correct? Resume some sports for keiki on Maui. Talk a little bit and share a little bit some of the guidelines and protocols that had to be put in place for that to happen.
We have our own return to play guidelines set forth. We use the model from the USA Football, and we made some adjustments to fit with the county rules and regulations with our parks. So,
what can you point out a couple specific things that you had to have in place?
So the kids who register with us, the coaches along with the players and the parents, they're given an app, and the app is basically used for them to do their health checks prior to them stepping on the field. The coaches are required to look over the app, make sure all their players have checked their their health app, and then from there, the players enter the field. Now, when they come onto the field, they're given a temperature check. We sanitize their hands, and then they place a wristband on their wrist, and that means they're cleared to play. So right now, currently, we're only running our flag football for our elementary students. But with the cancellation of MIL sports, football, we decided to open up for a high school and a middle school league, 7-against-7 flag football league. So we're working on that in a few weeks from now. But the procedures and the protocol as far as the return to play guidelines is extensive. From, like I said, the check-in procedures to the activities on the field, the coaches and players have to wear their masks. Unless they're involved in the activity, they can take their masks off. Kids who are on the sidelines, they're separated by 6 feet apart. We set cones so that there's no question basically on what is 6 feet. Constantly sanitizing the equipment, whether it be the flags, the balls throughout practice and throughout the games. As far as spectators, so Our elementary league is played at our Central Maui Regional Park, which is an open park. For practices, the parents are not allowed to spectate. They can sit in their vehicles, but they are not allowed to sit outside. However, during games, they're allowed to come onto the field and sit within their family pods of 5. So with the county rules, we're allowed 30 players on the field at a time, including the coaches. So we've restricted our teams to 10-pair teams with 3 coaches. And that's how we've been running the elementary school league.
Boy, so many things to think about. And really, it just kind of starts to touch on all the different variables depending on the particular situation, the sport, what indoor, outdoor. So we'll kind of go through some of that. And maybe we'll go next to you, Mr. Chun. So in your perspective, what do you feel like needs to happen for high school sports going again? You know, public schools, maybe something with the Department of Education, private schools. What are your thoughts?
Well, that's the $1 million question, and that's probably the toughest question, because if I knew the answer to it, we'd all be playing right now. But to me, we've developed guidelines. We've been working with the Department of Health to approve our guidelines and develop their own. The private schools are going. We essentially, as our organization, we put out guidelines. We worked with the Department of Health, and we said that if you follow these and you're able to play, you guys can play. So we allowed the leagues to play. I think some private schools have played, but the public schools haven't been able to get back on campus yet. And I think that has to do, and Mitch will probably be able to answer this better, but that has to do with getting the Department of Education approval to start extracurricular activities on campus again.
Share a little bit more about some of the guidelines you've been talking about, because Lieutenant Gomez kind of sort of broke it down a little bit. And it's interesting to see, what protocols are either in place or are being discussed that feels would be necessary for us to get to that point. What are some of the guidelines that you're talking about?
Yeah, so we based our guidelines. Our guidelines have gone through numerous changes, and initially we started with the National Federation of High Schools, and that's the guidelines that every state association was following at the beginning of the pandemic. We did tailor ours specific to Hawaii and Hawaii's needs. They used to have a tier system, and their tier system was a little bit different because every state has a different reopening plan. So what we did was we adjusted our tier system to match the Department of Education's Return to Learn tier system. So essentially, if a school is in-person learning, we said all sports are allowable. If a school is at home learning, we said no sports are allowed. If a school is blended learning, we allow low risk and moderate risk sports. So we adjusted our guidelines, and kind of like what PAL uses and probably all the leagues use about wearing masks, social distancing, cleanliness, that kind of thing. And we actually got ours approved by the Department of Health. We've been working with the Department of Health to draft their own. We've been working with the Department of Education because they have their own set of guidelines as well. Yeah, so it's all set to go. It's all work to go. We just need approval from the Department of Education to get started.
Do you have something of a timeline at this point, or a best guess as to when that would be?
So right now, I can see the Department of Education, their hands are tied, because I think, I'm not sure if Maui is still at person in home learning. Right now in Honolulu, parks are closed. So we need those facilities to play in Honolulu, because every high school doesn't have the luxury of having their own field to play on. So once those reopen and the Department of Education gives their approval, then I think they can go immediately. Now we can't start playing games immediately because these kids have been out of conditioning for almost a year now, or nearly a year now. So they're going to need a couple weeks to condition, train, and then we can hopefully have some kind of season to go in the spring. And of course, we're running up against graduation, which some start as early as May. So it has to start soon, otherwise they'll lose their second set of spring season as well.
Let me turn to you, Mr. Otani. So from a public school perspective, say if the Department of Education gives the green light to resume sports, overall, I don't know if it would be a blanket decision or if it's kind of more broken down from that. But as a school principal, where are you able to kind of jump in as far as how it's handled from an individual school perspective, or where do you think you should be able to have that control, for lack of a better word? What's the situation right now?
The Department of Education has a guidance document for restarting athletics, and The athletic directors as well as the principals are looking at it, and it goes through many iterations and different versions. And all schools, I believe, are working hard towards setting up their own protocols for their own facilities that abide by the guidelines set forth in that guidance document. Uh, but again, it's really hard for us to uh, predict when we're going to start because without having, not all schools are going to get their kids back on campus. There's many schools that are not returning any students back to campus until the fourth quarter. So with that being said, um, we're looking for the green light, and we're hopeful that we can start at least something soon. We really feel, the principals all feel for the students that were not able to have a spring sports season last year. And we really don't want them to go through another spring where that will be 2 seasons lost for those kids. So again, there are a lot of protocols and things that we've developed, but we're waiting to try to put them into play as soon as we can.
So just to follow up on that a little bit, Mr. Otani, so what is your understanding at this point? Say if the Department of Education comes down with the green light, they hand the protocols to you and other principals. Is there some play there that you can work with based on what you feel is the best situation for your school, or is it going to be pretty, as far as pretty strict as far as this is what the protocol is going to be and that's it?
I feel that schools will have their own set of protocols, but in terms of which sports start, we would rely on the OIA to set, let's say, maybe they say, well, we can start golf. Golf seems like a relatively safe sport. Maybe we can start that. And if everything goes well with that, maybe 2 weeks down the road, we can look at tennis. And, let's try, I believe that we should try to look at incrementally and try to see what we can do. And we may never get to judo because of the contact, but again, I believe that we should try to start sports with the ones that are low risk and that we can do successfully. So once the OIA, once the department gives us the green light and the OIA sets up some kind of schedule, we can start practicing and do what we need to do to make sure that the kids are safe.
And when you talk about what could be considered low risk, that kind of turns me to Mr. Keem and Mrs. Fonseca. Mr. Keem, so from the Oahu clubs and some of the clubs on neighbor islands, actually, I believe, in youth soccer, have been able to get some of the leagues and the games going. What have they done for that to happen? And do you think it's working? What's your share a little bit more about what's been happening?
Yeah, on the other islands, they've been able to go. We haven't been able to, just because each island has its own protocols and coming back. They've been somewhat successful in Maui, I know that, and Big Island, getting their leagues up and running. Granted, they're much smaller than we are. We make up 96% of Hawaii State youth soccer players here on Oahu. So we've got all these statistics that we've got to go against. We've got to be under 1%, and we've got to be under 20 cases over the 7-day average before we can start playing. We've put in our protocols. We put them back in August when we were hoping to start playing. They were a lot more strict than what came out in the Hawaii Safe Sport guidelines that came out last week, that the governor still hasn't approved. So our clubs have been practicing illegally in parks without permits, as small groups as they can. There's lots of danger to that. There's insurance risks. Players could get hurt. Insurance may not cover them. But the clubs are flying all over to the mainland just to play games now. Wow. So we've raised the cost on all of our families. That's a major issue. We're going to price kids out of playing soccer here because we're not allowed to play here in Oahu.
So a big problem then for Oahu is the volume, having to deal with the volume of kids. Is that right? And then also the county, city and county of Honolulu is being a little stricter with their protocol. Am I reading that right?
Yes. Yeah, Mayor Blangardi had gone to Governor Ige last week, I believe, with the plan that Council Member Tupela and Chad Owens worked on with 180 other sports clubs here in Oahu of all sports. They came out with a 44-page guideline with what we should be doing. So right now, we've asked all of our members, and all the other sports have asked their members to write to Mayor Blangardi to put together an executive order to hopefully be able to move sports into tier 2 or 3 so we can actually start training at least, so the kids can get covered by insurance and everything else, so everyone's safer, and we start to provide a more safe environment. We've put in our protocols to help get that going. So.
Well, so let me ask you, Mrs. Fonseca. So you, I would imagine it's been tough with it being, a family-owned business, and we can get to that a little bit more. But let's talk about the sport of gymnastics and sort of looking at these types of sports where, for example, they're performing on separate apparatus, generally as individuals. So this is a sport where I would imagine that for the most part, you can be assured there'll be more separation when the athletes are performing or competing. Do you think that a sport like gymnastics or others that have this less interaction should be allowed to compete right now?
I definitely feel that they should be. I think that we've done over and above and beyond what we are capable of doing, to make sure that the safety of the students comes first. We're able to, especially when it comes to outdoor activities as tennis and swimming and golf, those types of activities. In relation to gymnastics, our facilities are indoor, but our equipment is spaced. The requirements and regulations of our equipment helps us in aids in making sure that the students are separated depending on the amount of athletes that you have in your facility at one time and the size of your facility, as you could say, because we are an indoor sport.
How has that been for your business?
We knew that it was going to be a challenge when we decided that we were going to, keep things going. And it's been slow, but we've been getting a lot of interest as parents are realizing what we do. And we're keeping our classes really small. And the activities that they do are pretty much spread out. And then we have our guidelines from USA Gymnastics, along with our safety guidelines that we follow here, that help us to make sure that our staff and our coaches are doing what they're supposed to after every class, and that the parents are aware of what's going on when they intend to enroll their children.
So when it comes to resuming sports, I know there's a lot of different avenues we can take here, but I want to touch on something that Mr. Chun, you had touched on as far as being able to resume sports based on what's happening within that school or that district. Like if they're already allowing in-person education for the students, then maybe those schools, or would you say those districts, would then allow the sports to happen. Expand on that a little bit more, and maybe if anybody else wants to jump in as well, as far as, when we're talking about what's happening with school learning in general and which schools or which districts are allowing students to attend in person, should that be tied to what should be allowed for sports?
So we wanted to make our guidelines as simple as possible. I think at the beginning it got confusing when the state had a tier plan and all the counties had different tier plans. So the only thing where we saw was consistent was the Department of Health's plan for return to school. So we felt that matching it with that was the best way, and the DOE guidelines follow that. So theirs is matching according to where every county level is in their return to school plan. What we felt was like we when we talked to the principals and stuff, it's like if you're not even in school, their primary focus should be worried on getting kids back into the classroom. And if they're learning from home, then obviously the school isn't ready to have kids come and practice and play games on campus as well. So we wanted it to be where for us, it's always focusing on the student athlete aspect, and it's student first. And so if it's safe enough to have the kids come to school, and then hopefully it will be safe enough for them to do extracurricular and continue their learning in some kind of way after school, whether it be on the field or through teamwork and that kind of process.
So maybe Mr. Otani, if you want to jump in here and your thoughts on that, but also kind of taking a look at the facilities themselves, the schools themselves, and how we kind of think about what we would consider safe, because you have different situations in every school, on every campus, and I would imagine that some are built in a way where if you're I think there's some surveys out there that say the playing of the games themselves, there isn't all that much risk of transmitting COVID. But when you're in transition, whether it be in the locker room or when you're traveling, that might be the time when you might be at higher risk. So how do you then think of that as a principal, for the campus, for the school, how you roll this out? Should that be one of the leading factors in what is the actual layout and the ability to separate people?
When we look at the sports that are available in the spring for us that we hope to start, golf should be relatively simple. Parents can, or the students can drive themselves, or it doesn't take much to get them to the match. But if you start looking at a baseball team, or if you got to travel with a track team that has 150 runners, you kind of put them all on 3 buses. It creates a little bit, it creates more risk if you do that. So there are a lot of logistical things we still got to work on as to try to figure out how we can do this. But the actual practice on your own school site, I think most schools, if they are back in school and in-person learning, have the protocols during the day for the kids and the kids are following it to remain safe. And then we just have to extend it and make sure that we add on additional protocols to make sure that the risks are, some of the coaches are not faculty members. So then we got to make sure that they understand the protocols, including making sure everybody has the communication documents. And so a lot of logistical things, but I think most schools and most principals with their athletic directors have planned accordingly, and they have things that are ready to go once we can get the go-ahead to start our sports. But again, for Kalani, we don't have our own baseball field. We don't have our own softball field. We have to rely on the city and county. So we cannot start those sports until they allow us to practice and play on those city and county sites.
So here, I want to get to a question here. This is from says a concerned parent. And I'm not quite sure who to direct this to. I think this could be for some of you who are working within the school district and also after-school type sports. That's actually more specifically the question. Are after-school sports coaching and staff, athletic trainers currently allowed to not social distance and touch, have contact with the students, say if there's a non-emergency situation? They're saying that their child attends a private middle school, participates in cross country. There's training that happens and stretching that happens afterwards with some of the coaches and staff. When you think about those kind of other situations that happen outside of the game itself, where there's interaction of some kind, I'm going to turn it to Lieutenant Gomez and Mr. Keem, just because there's all those things that you have to think of as well. Whether you talked about Mr. Keem, sort of the travel to be able for them to be able to play, and Lieutenant Gomez, you talked about the different types of protocol as they're in transition and then out there in the field. When you have someone, a parent like this, saying, "Okay, what about all the others? About all the other touch points that can happen outside of the game and outside of the school?" How is that being monitored? How is that being, watched to make sure that it's a safe situation?
For us, as far as our league, we have our officers that are out there we run about maybe 5 to 6 officers per game, and they regulate the players, making sure they're at their cone. We also assign coaches to be the COVID monitors, to making sure that their kids are in the right place. As far as like in the past, at the end of the game where everybody shakes hands or gives them the high five, we do a shotgun out, to the opponents and to the families. So we regulate the field because we're the ones responsible for the permitting of the field, and we're responsible for the kids. So we're actually out there in full force and making sure that everybody stays safe. Like I said, we have a check-in policy where the kids can't even come to the field until they're escorted by their coach. And they all have to be together, all 6 feet apart. They'll walk in a line, they'll check in with us one by one, and then the wristbands are applied, and then they're cleared to play.
Right.
So that's kind of how we do it. Listening to everybody else, we're very fortunate to be able to play, and listening to the other concerns that, Oahu has and whatnot. But like I said, we're very fortunate with our county parks, our mayor, so.
Mr. Keem, what protocols have you put in place? Because this is still, you guys are doing what you can to be able to sort of figure out how the kids can, get some practice and get some play time. What protocols do you have in place, and what have you structured to provide safety for the kids?
Okay. Yeah, so we put in place, we were going to extend the intervals between the games so the families could come into YPO Soccer Park and then exit, and we'd have more time. So that cuts down on the amount of game time that we could actually have, but that's okay. And in between that, again, no handshakes or anything like that. No potlucks after the games anymore. I know that's a big thing here. I love that aspect of it. It creates that community. It makes it a great environment for our soccer programs, but we've had to say none of that. We're going to be hiring more staff to manage the game days, just to make sure people are doing what they're supposed to be doing. We had put in place that there'd be no spectators, but we're still reviewing when we actually get to start to go back out. Are we going to allow the little pods of families or not? We've been off since March 13th, so we have not been allowed to do anything since March 13th of last year. So, it's all just hypothetical right now that we're trying to put together, and listening to Terrence here, we'll take some ideas from what he's got going on too. So,
Miss Fonseca, talk a little bit more about sort of what's been happening with the sport, because I know there's a lot of sports now, whether it be golf or some of the sports out in the ocean. I know surfing and dirt biking has gotten really big, all because it provides more separation or more opportunity for separation. What's been happening within your sport, amongst your family of gymnasts, that is helping them sort of figure out how can keep the sport alive here, what they're comfortable with, and what they feel are the benefits of this type of a sport?
Well, I believe that a lot of what our jobs are to provide, whatever we're doing for the students. It's the coaches' jobs, it's the leaders' jobs. We're doing what we have to make sure that we can continue to do what we're doing. So basically, built on that, all of us have eliminated the things that we know that would be dangerous to our competitors. So for us in gymnastics, the competition programs and the recreational programs for young children are completely different. So, and just like the aspect for me, and I think that's the topic of what we're discussing right now with the competitive program, we're basically have been fortunate to train in our gyms and get our gymnasts back on the equipment and on the floor, but we had to do the gradual comeback. The gradual comeback of, because it involves height and rotation, no contact, but basically the independency of building athleticism, had to be in the forefront. So we've been pretty much back now for 3.5 months, and we missed our season, which is really important for girls and boys in gymnastics that are pursuing college scholarships in their sophomore and junior year. By the time they're in their senior year, they would have already been looked at, done their videos and had competed at regionals and nationals to show that they're the competency. So we missed that last year. Our season starts in January, ends at state championships in March, with regional and national championships between April and May. And we're in February. So we haven't had anything going on within Hawaii, but in North America, the other 49 states, they're really going. They're going. They have, their protocols all set down. They've got the government backing them, which is, I always try to say that you have to keep your vision here, trust the process. This is our home, and we do what we can as leaders to be positive and do what we can do. So that has been very, very helpful. But as far as the season's concerned, I think Hawaii is looking at pretty much another disadvantage, because even with our regional championships, we've had to decide as business owners if we are going to travel, if we are going to risk taking our students to Utah, to Montana, to Florida to compete at regionals and westerns and nationals. And for our program, Rainbow Gymnastics Academy, we've decided that we will not travel, and that's what we've had to do. However, we've put in place a season of our own within our gym, and the community is coming together with using Zoom and having the officials view the routines that way, elaborate the scores, and then turn them in so that the students can still qualify within their level to try to shoot for whatever potential that they could if they were participating, as a means of some normalcy or season that we can incorporate now, so that way we can track and project for 2022. So basically that's where we are right now.
That's
but
great.
Everyone's been really excited, and the kids are happy, even if it's within our own home. And so we're doing what we can.
Yeah.
So
that's a
pretty
great
much
way to think outside the box too, when with some of these different sports. Now I want to circle back that to a little bit with some of you as far as the scholarships moving ahead. But I wanted to get to a couple of these questions. Not surprisingly, Matt from Wyatt and another individual, a similar question on testing. So asking, will the DOE require COVID testing of students and faculty before restarting sports? And also a similar question, is the state going to provide daily COVID testing to student athletes? Chris, maybe, do you have some insight on that?
Yeah, so when we've been meeting with the Department of Health, they said a comprehensive testing program will not be needed for high school sport, the resumption of high school sports. Basically, you'd need a rapid test before an event, and you need it to be 99% accurate, and there's no such thing that exists that would be cost effective to do that. We're not taking these kids and putting them in a bubble and then giving them a test and waiting for the result and then have them play. So that wouldn't really be feasible on a high school level.
Okay, this one I think maybe is going to kind of go to you again too. This is Jenny from Waipahu who's saying, why are playing sports tied to classroom attendance? Can't we just let the kids play? Being on a baseball field safer than being in a classroom, if you look at it that way, as far as physical space. Why did it need to be tied to whether or not they're attending in person?
Personally, I agree sports is probably safer than being in a classroom, but to me, and I'm a staunch supporter about this, we're education-based athletics. Our kids are students first. They have to be able to get in a classroom. For me personally, my son is a high school senior. He plays baseball, so he missed his junior season. If the public schools don't start again, he's gonna miss his senior season. I think it's safer to be out on a baseball field than it is to be in a classroom, but I understand that the schools have to open their classrooms first, because the principals like Mitch will field a ton of calls saying, hey, why are these kids being played sports, but then my kid can't even come to your school and attend a class in person. So I think they're principals, they're school leaders and community leaders first. So they have to make sure that they take care of what goes on in their classroom first.
Did you want to respond to that, Mr. Otani? Your thoughts?
I think all principals across the state of Hawaii realize and understand how essential it is for the physical and mental well-being of our students across the state to return to some kind of physical activity and athletic participation. But that being said, we want to make sure that we can do it and do it in a safe manner. And And we want to open our schools first. And for us at Kalani, we're lucky to be in a little bit in an area where they have not been as many cases as other parts of the island. So, we have returned students back to campus, and I think we have all of our students in a hybrid manner now. But other schools are struggling to get their kids back because they may be in a hotspot area where there are a lot more cases, and their priority for those principals are to get their kids back on campus. They're getting calls, why can't they come back? But they have positive cases on campus, and it has been hard for them to get. So understanding that we have to balance all of this and try to look at what is best and safest for all of our students. We get the same question, why can't we start up robotics again? Why can't we start up this club or that club? And so we get the two sides of the coin. We have parents that want to send their kids to school every day because my child is struggling at home. And we have the other parent that says, I'm not going to send my kid to school because we don't feel it's safe yet. And so we continually talk to parents on different sides of the coin, trying to balance it all but again, when we look at it, health and safety trumps all.
Yeah. All right, here's a question that really, it's asking about HHSAA, but I think it applies to all of you. This is Christina from Waipahu asking, what is the HHSAA doing to help high school senior athletes get scholarships to colleges? Are they losing out to kids in other states? And actually, I know that it is kind of, in a sense, addressing you, Mr. Chan, but really, it's kind of for all of you. And I almost want to kind of ask Mr. Keem on this one, because you think about, a sport where it's not, you're not able to get as much practice in right now. You're having to possibly go to the mainland to be able to get some play. And you think about, what these kids are trying to do in the interim to make sure that they, have a future if they want to in sports. What is your response to this? What are you looking at to try and help them make sure that they still have those opportunities?
Yeah, everyone keeps saying, oh, we've been doing virtual training, everything like that. There's only 7% increase in virtual training from pre-COVID levels. And right now, the 15 to 18-year-old age groups, which would be the groups that are doing the showcasing, they're getting a 65% in reduction in game times, practice times, and any type of free play. So they're losing out tremendously here, especially in Oahu. What can we do right now? We run a giant showcase camp. We bring coaches in from all different divisions, junior colleges and everything else. Players get identified to make the regional team for the Western region, then into the national team levels. And with Oahu, we have a high rate of players going on to college from soccer, and it goes across all sports, I believe. But we have the highest per capita rate of Division I women's soccer players in the country, and we have a lot of professional players on the men's and women's side as well. So this is really hurting us. We have to think about the long-term ramifications, not just the short-term. There's test scores for the kids, their mental health, all these things that are really important. Are they going to be healthy adults if they take this off? Because right now, what is it, like 3 in 10 parents, about 30%, are saying their children are no longer interested in sport coming back when we can start again. So long term, we're really doing damage by not letting the kids get back because we can't figure out a safe way to get into playing sport. It's been shown across all over every state. There haven't been mass super spreader events, even in these giant soccer tournaments that are going on, that teams from Hawaii have gone to. In Arizona and Texas, where there's massive cases of COVID, they've been able to run safely. We need to be able to run sports safely here to change what's going to happen in the next 10 years to these kids. Healthy kids make active adults.
I've been hearing some schools, they're allowing kind of almost rollovers for scholarships, like they're allowing sort of a pad year. Are you seeing that?
I haven't heard anything about that. There's been a dead period for recruiting in terms of what we've been able to do with the colleges.
Mr. Chen, do you want to respond? I know that was actually to you as far as HHSA, what they're doing to help with scholarships. What are you seeing? What are you able to do?
Yeah, so I want to just remind our viewers, our mission is about education-based athletics, not about getting a college scholarship. The majority of our student athletes will not get a college scholarship, and it's probably going to be 99% won't. Our goal is to safely resume sports for all of our student athletes, not just the ones getting scholarships. I sympathize for the kids that need the season to recruit. It's just our mission is to get every kid back out there, not just the ones that their college education depends upon it. Yes.
Yeah. No, good point. Good point. Thank you for the clarification. Mr. Otani, I know obviously the same would apply to you, but for some, I know that's what they're looking forward to as far as trying to get a scholarship or at least reach for that. Is there some assistance, or what are you seeing as far as options?
You know, with regards to a lot of the students, like our kids that are good golfers, they're still golfing, they're still out there, they can enter other tournaments, whatever. But again, for us, for soccer, it's going to be tough. But the ones that have been identified, they've been identified from a very young age. So they are traveling to the mainland, they are getting those things. What I feel for is the seniors that did not have a junior season last year for the spring, and they don't have any tape of them playing varsity sports. And if they get their season taken away this year in the spring, then they don't have anything as a varsity athlete. And so I feel for them, but at the same time, I agree with what Chris said. My goal really is to try to get our kids to an in-person graduation. I want that first and foremost. I would love to have athletics in the meantime, but that is a rite of passage for kids in the state of Hawaii as well as across the nation. I would like to get our kids so that we can get facilities to open, that we can do a in-person graduation for our graduates.
Right.
And that's very important for us.
Now, Mr. Keem, you touched on this, and maybe I'd ask this of Lieutenant Gomez. It's a question from David. You talked about the mental state of kids and how this is all affecting them. And David's question, does anyone know if juvenile crime and suicide rates have risen during this time when the kids have not been allowed to play?
Answer that?
Lieutenant Gomez? Yeah, please. Yeah.
All right. The common trends that we're seeing, just to give you a little bit of background, I work for the juvenile section here. So we deal with a lot of the juvenile cases that come through our patrol units. And what we've been seeing is juvenile crime obviously is down. Drug cases are down. Juvenile arrests are down. But what we're seeing more often than not are the beyond parental control type cases, which are children whose behavior can't be controlled by their parents. So they call the police for us to parent them. Children whose behavior may be injurious to themselves or others. Children who refuse to attend school, log in. We had to put together a team called Team Malama to pair with the DOE counselors to do home visits for kids who aren't logging in. Just the start of the school year, we did 150 home visits. So another one with suicide and suicide ideation type cases. We follow up with these kids who have these ideations, and it's commonly heard. They're frustrated, they're alone, they're confused, they're missing their friends. Last year alone, out of all the suicide and suicide ideation type cases that Maui has had, 68% of them were juveniles. So what is that telling us? As a community, as a department, as a division, are we doing enough for our kids? I think, I listen to all the broadcasts that, PBS has put out. I've seen it on the news and everybody talking. I've attended numerous meetings with teachers, educators. We have SROs that work in our public schools here, our high school and middle schools. And we hear the same thing, we're exploring options, we're exploring ideas. We got to put our kids' needs first, above our own. And, last year, I'm very passionate about this because, last year we lost one of our students to suicide. And, they struck me real hard, and a lot of my fellow officers also. And that student left a note, on his, on their laptop computer that was issued by the school. And in summary, they wrote, they were sorry, they couldn't take it anymore. They missed their friends, their mentors, and the joys of being social,
Yeah.
we hear, like I said, all the time. In the last broadcast I heard, resiliency. The kids are resilient. They'll pull through. They'll persevere. We all want to believe that's true, and some of them do. A lot of them do. But coming from a law enforcement officer, who's worked with juveniles for most of my career, I've taught driver's ed. I was a coach. I was an SRO. I learned not all kids are resilient. Not all kids will persevere through this. These are the kids that we as a community we need to save and bring back youth sports. This is a lot of them for them. This is their out. We're a free league. A lot of the kids that come through us, they can't afford to play regular youth sports that that you charge for. So, like I said, we make so many, promises, or, we put everything, like, I don't even know how to explain it. Make a decision, as far as sports, and live by that decision, but make a decision. It seems like we're going around and around and we're saying, we're trying this, we're looking at this. Who's suffering in the end? Our kids. Our kids. That's who's suffering. But that's all I gotta say. Sorry.
Now, Mrs. Fonseca, I would imagine with a long-time family-owned business, these families really well, and a lot of these kids really well. What have they been saying? What have you been hearing? How are they doing?
I do agree with Lieutenant, and I feel that the biggest thing for us right now in the leadership role and seeing where we've come from last year till now and what's happening, I don't want to compare, the mainland to Hawaii, but I really feel that we're hurting our students and our children by keeping them from being active in sports. And I think they rely on us. We're the ones that they're counting on to back them. And it has been very inconsistent. It's been zigzagging all over the place. To own a business and have been part of that zigzag has been, you kind of lose faith in a lot, but you have to have, the strength to get up on your feet and protest or say how you feel or go to a rally or, whatever. But, I understand the principal's point of view as well, knowing that there are the majority of students and the needs and the priorities of the events that are customarily nature to us, graduation, the proms, all the activities that we have traditionally, for our students. I think health and fitness is really important because they tie together. They really nurture each other both. And if it's an organized sport, they're around people who care, the mentors, part of the village that's built the character for the child that, the child will rely on, and remember, for years to come, because, we are passionate about what we do, and it's more for, for the kids. I think that's what we do. We do it for them, so basically I think that they're counting on us. And, if I'm fortunate to have our athletes in the gym. As a gymnastics coach, we raise them from when they're young because it does take years to progress and any sport to build the skill to get where they need to. They're devoted, they count on us. And I think we've really kind of procrastinated for quite a while now on where we're going with this, for it is a priority, just as important as education. It's essential. And so where we're going, hopefully we're going in the right direction, and that something will happen soon, so that way we can do what we can through March, April, and May.
And no doubt some people are, people are frustrated. Alika sending in saying if getting students back in school is top priority, why is it taking so long? So no doubt some frustration out there. So talking about getting kids, back to playing again, there are all these different things to think about that a number of you have touched on. One being wearing a mask and when they should be wearing a mask. What are your thoughts, maybe Mr. Chun or Mr. Otani, as far as when should kids be wearing masks? Some concerned about, being more difficult to breathe.
I think So when we've been working with the Department of Health guidelines, initially our guidelines said that the kids had to be wearing a mask when they're not participating, when they're on the sidelines, like what Lieutenant Gomes' league is running now. That was our primary belief. But I think the Department of Health, if they approve a return to sports guidelines, it's going to be they have to wear a mask at all times when participating in a high school sport, except for water sports. So it's going to be like if they're playing baseball or they're playing softball, they're going to have to wear a mask. If they're playing volleyball, they're going to have to wear a mask. And I guess they went through their doctors and they said the oxygenation issues isn't an issue. It might be for maybe the kids with health issues, but that's going to be something that the kids are going to have to get used to if they're going to return to sports. And I believe there's 14 states right now that are playing all sports with masks on.
Let me ask you, Mr. Keem, being that this is soccer is an outdoor sport, do you feel there should be a difference between outdoor sports and indoor sports as far as certain protocols such as wearing masks?
No, I've seen some states like Massachusetts that ran their club soccer league and their high school sports soccer league this fall. They ran it all with masks on. They modified the rest of their rules for soccer, but they were able to run it. I've seen people in the U.S. Olympic trials run the 10K or whatever with a mask on. I mean, if they're running Olympic trials with masks on, I think our kids can wear masks for activities in all sports. Like, let's just be safe. And we're here, like the principals have said, to raise future adults, good upstanding citizens. So let's just be safe and get out to play.
Mr. Otani, let me ask you about the coaches and staff. How are they feeling about resuming practices and games?
For many of our, the ones I'm in contact with are the faculty coaches, and many of them would like to start up. They've been emailing kids, and kids have been training and doing whatever on their own. They are now at least in contact with the kids, so they're talking to them. And now that the kids are back on campus, they're able to interact with them, and it's been nice. And they want to come back, and they want to go the next level and have the state open up athletics for kids. I think across the board, many of our teacher coaches are advocates for athletics, and they believe in the value of athletics as long as it can be done safely. And they're able to look at the protocols that we got to put in place, and they can go that extra 9 yards to make sure that it's enforced, that the kids are following it, that they will be safe out there. So for us, the ones that I've been in contact with, they're all in favor of restarting athletics.
I think we have just a couple minutes left. I wanted to ask you, Mr. Chun, currently Governor Ige indicated he's hesitant to loosen restrictions on Oahu. Do you feel you have enough support right now to change his mind?
I wish. I mean, we have Councilmember Tupola. I think all the mayors were in support because they were all on that conference call with her. But really it's going to come down to the governor and the superintendent, because the superintendent has to allow it on the public schools, and the governor has to allow it statewide. So those are the two main decision makers that ultimately will have to give the go ahead for us to start.
And I want to turn this over to you, Lieutenant Gomez, the coaches for Police Activities League on various islands. They're volunteer police officers, correct? Why is it so important to have these PAL programs and for them to give back to the community in this way?
I think for us, it's building the rapport with the kids, bridging that gap, targeting, like I said, our at-risk kids, and just providing a safe venue for these kids to learn. Our 5 core values that we teach: respect, responsibility, integrity, sportsmanship, and servant leadership. And for us, we see the impact as they get older. These kids, they remember, he was my coach, and they're adults, and you see those stories. I've had a kid that came through, that played flag football because he couldn't afford popcorn, but played high school ball, and he made it to the pros, and then when he came back, it was like, hey, you remember me, and now he's somebody, but it's so worthwhile for us officers to connect with our community and give back. especially with our kids. And you see the joy in their faces. They enjoy it. I mean, you would think that they'd be, you know, not paying attention or they'd be bouncing off the walls and all that. And no, you know what? Every single one of them, the smiles on their faces is just, it's totally worth it.
And we've got just about 30 seconds left. And maybe Ms. Fonseca, you want to share a little bit more about what you share with your students and athletes to give them a little more hope?
Basically, it's been to trust the process. You know, if we can set the guidelines and if we can set the protocol, knowing everything that we do now, we're educated, we're smarter now, we know what we're dealing with, we're on the right path, we have things happening that are real positive within our community. We want, as a community, to get going. We want our lives, our kids' lives to get going, and that's the direction.
Thank you, and mahalo to you for joining us tonight, all of you. We thank you, the Executive Director of the Hawaii High School Athletic Association, Chris Chun, OIA Council Member and Kalani High School Principal, Mitchell Otani, Cora Fonseca, owner of the Rainbow Gymnastics Academy, Christopher Keem, President and CEO of the Oahu League of Hawaii Youth Soccer, and Lieutenant Terrence Gomez from the Maui Police Activities League. Thank you again to all of you for being here. All right, next week on Insights, we're tackling the controversial proposal by the Department of Hawaiian Homelands to build a casino in Kapolei. Please join us then. I'm Laurie Amata for Insights on PBS Hawaiʻi. Hui hou.